My name is Dr. Bowen Jiang. I'm a board-certified neurosurgeon and spine surgeon. I'm the director of the St. Jude Neuroscience Institute, and I also am the director of the robotics program, spinal robotics program here at St. Jude. So the Globus Celsius GPS is a next-generation robotics platform for minimally invasive spine surgeries. When we hear robotics, people tend to think that a robot is doing their surgery. It's a little bit of a misnomer because as a surgeon, I'm still the one that's doing the surgery. The robot is kind of like a Apple Maps or a navigation. It helps me put implants, screws, rods into the human body with less invasiveness and with pinpoint accuracy. So typically for a patient undergoing spine surgery, it's a pretty big cut in the middle of their back. And we have to use a lot of x-rays in order to see where we're going. With the robot, we're gonna ask the patient to actually get a CT scan before surgery. And that CT scan is kind of like a planning study that allows the robot to use that to navigate around the patient's body. I would pre-plan their surgery. I would know exactly what their anatomy looks like based on imaging. That imaging is then transferred onto the robotic platform. So when they're in the operating room, I know exactly what size implants to use, the exact trajectory and location. So I can really custom tailor my treatment plan for that specific patient based on their anatomy. So we need to be very precise when we do surgery. And that means if I'm putting a screw into the bone next to the spinal cord, I cannot miss. So one of the greatest benefits of robotics is image guidance. It allows me to put that screw exactly where it needs to be. And it's almost always perfectly accurate within maybe 1 or 2 millimeters, right? Which is very well sufficient to ensure there's no nerve damage or abnormal touching of a spinal cord or nerve. When we do this minimally invasively, we're not cutting through the muscles. We're actually dilating through the muscles because the imaging platform, the Globus Celsius GPS, has the ability to almost act like X-ray vision. It can see through your body. So the benefit is less tissue disruption. If I'm not ripping that muscle off your back to do the surgery and I'm preserving all the muscle and ligaments, then you recover faster. You have less pain, less bleeding during surgery. You're able to get back into the activities that you enjoy. You may rely on pain medications less. So to the patient, if we can make them more comfortable, but still achieve the goals of surgery, that to me is win-win for them. Globus platform is specifically for the spine, but it is used for all areas of the spine. So not just lumbar, but sacrum, the tailbone, sacroiliac joints, all the way up to the cervical, which is under the neck area, as well as the mid-thoracic chest area of the spine. All of the neurosurgeons here at St. Jude know how to utilize this machine. We're trained on using it, and we certainly have the highest volume when it comes to using this robot for spine surgery. And volume matters. You want people and surgeons that are very experienced in doing this surgery and know all the nuances of how to use this technology. I will add that in all of California, there's only one teaching center for the Celsius GPS robot, and we are that teaching center.